Berberine is a popular plant compound for steady metabolic support. But how much should be taken safely and effectively? Whether supporting blood sugar, energy, or body composition, knowing the right dose for comfort and consistency matters. Berberine comes from plants like barberry and golden seal. Sold as capsules or powders, it's often used for stable blood sugar, metabolism support, and daily wellness. Berberine may act on a cellular energy sensor, helping the body use glucose and fats efficiently. Steady, consistent use tends to show results over time. Studies often use 1,000 to 1,500 milligrams per day, split into 2 or 3 servings. Starting lower helps gauge comfort before adjusting. A simple plan: begin with 500 milligrams before 2 main meals. Adjust timing to meals or slightly before if your stomach is sensitive, tracking your energy and digestion. Body size, appetite, and daily activity can affect the ideal dose. Larger bodies may tolerate higher amounts, smaller bodies may need less. If your goal is blood sugar support, pairing doses with meals works well. For weight management, taking it before meals may fit best. Always start low and increase gradually if comfortable. Take Berberine with meals and water to reduce digestive upset. Begin with 1 dose, then add a second if well tolerated. Track timing, meals, and comfort to optimize results. Some may experience mild digestive upset at first. Pause and consult a healthcare provider if discomfort continues or if taking blood thinners, glucose-lowering drugs, or other medications. Speak with a provider before starting Berberine if pregnant, breastfeeding, or managing chronic conditions. Discuss your goals, dosing, and any medications to ensure safety. Berberine may support blood sugar, metabolism, and wellness when taken consistently and safely. Start low, track your routine, and adjust gradually. For weekly evidence-based tips on natural supplements and healthy living, subscribe to Nation Health MD and stay informed.